Hello, this is Shelby Custer, and this is my video presentation for the Module 4 assignment. And today we are talking about the case scenario where we have the 54-year-old female brought in by EMS after a fall that caused her to scrape her arm and face. She was screaming, she's bleeding, disoriented, combative, accusing the EMS of theft, and stating that she just needs a bottle. She is found wearing very dirty clothes that smell of BO and urine. So, what is she suffering from? I think most likely it's DTs, which is alcohol withdrawal. She could also be homeless based on her appearance and her hygiene. And there could also be some underlying mental health issues that we're going to have to deal with. A lot of alcoholics and substance abusers use their substance as a form of self-medication for mental illness. So short-term risks, with the DTs, she is at risk for having seizures. So we want to keep an eye out for that. Maybe precautionary, put her on anti-seizure medication, which would be in tandem with her benzodiazepines for the anti-anxiety, which would be either Valium or Librium. Head bleed. She is at risk for head bleed because she fell, and because anyone with alcohol in their system is at a higher risk of bleeding. We do want to factor in that she could have a head bleed and definitely address that. She could also be suffering from malnourishment because of the alcoholism and homelessness. She's most likely malnourished and dehydrated, so IV and fluids. Long term, we're looking at most likely liver failure. She stated in the ER that she needed a bottle. So this to me tells me that she is familiar with DTs, with alcohol withdrawal. So most likely she's gone through this before, which means that she's been using alcohol for a longer, more of a long-term basis. So I would suspect liver failure. DTs, this is why her hands are shaking so bad. This also goes along with the confusion, delirium, hallucinations, paranoia, the anxiety, and a lot of patients also complain of crawling sensation of their skin. My assessment would include vital signs. Usually people going through DTs are in the ICU, so her vitals are going to be monitored constantly. We want to make sure that she's saturating oxygen proficiently, because alcohol is a CNS depressant. We want to make sure that she's breathing efficiently and oxygenating her body. We'd want to do a neuro assessment. Because she did fall and hit her head, possible risk of more likely a head bleed, but because of the malnourishment, bones are more brittle. She's more likely to have some form of break. She could have a spinal fracture as well. CT scan, we'd want to visually inspect for a head bleed, of course. And then lab values, I'd want to see her CBC, CMP, and BMP to test her liver function, get a white blood cell count to rule out any form of infection. And we'd also want to do CWA, which is a scaling system of the symptoms of DTs, and this kind of tells us the point of like what phase they are in DTs. So this would help determine our treatment and how often meds would be given. And I would also consult psych. Definitely want to get a psych evaluation. We need to determine her history of mental illness, if there is any. And I would also want to get case management on board. They would be able to help us locate any family for her, so that we can get a better picture of her history of alcohol abuse or mental illness, and of course, any other past pertinent history. And this leads also into our research question, which asked to talk about how insurance is or is not sufficiently covering people with mental illness diseases. And so I pulled up some statistics here, and research showed that insurance is not sufficiently covering mental health illness. 20% of people, treatment needs are not met, or close to that 21% of adults aren't being treated because of costs or insufficient insurance coverage. And so either they don't have access to insurance, they don't have access to the treatment, or the insurance they do have either doesn't cover health insurance at all, or isn't covering all the treatment that they need to live their best life. And another sad statistic that I wanted to include was that almost 8% of private insurance covering youth doesn't even cover any form of mental illness at all, which is really sad, in my opinion. So 3 things that I think would be able to improve the coverage of mental health treatment. Advocacy is a big one. I think that there needs to be delegates for each patient, whether it be a caseworker or a social worker, to help manage the care, help manage this patient's treatment, help streamline everything. Personally, I've had family members where the transition from an inpatient psych to outpatient, they lose all their medication. And so they go from being inpatient, where they're basically controlled and they're on all these psych meds, to being outpatient, where they don't have maybe all the resources, and they also don't have all their psych meds that they've been taking for so long. So case management is great for streamlining these transitions between phases of care. We need to increase the accessibility, whether it be accessibility to insurance or accessibility to treatment, and integrate mental health into primary care practice. I think that if we start treating mental health illness as if it's any other illness of the body, and that we make it more accessible, just like walking into an ER or walking into your primary care physician's office, these people can start getting the help that they need and the help that they deserve. And that is my report. I hope you enjoyed watching. I hope you enjoyed the PowerPoint presentation. I will leave my resources here for you and get my face out of the way. And I look forward to your feedback. Thank you so much.